and this is this is a Botox treatment, and so Botox, you don't see anything right away, but combination therapy is more and more what we do. So what is Botox about? Make it look like you're worried or mad. She actually, because of the lidocaine here, she can't move those muscles as much, but I saw her before, so I know they move. So I'm going to be injecting Botox. And the idea behind Botox is the muscles that I'm injecting right now, this is called the glabella. There are two things that occur here. Number one, these 11 lines, by weakening these muscles, it softens these 11 lines. What it also does, these are the brow depressors. These are the muscles that bring the brow down. If you just treated this and you left the frontalis alone, the net result would be a brow lift, because this muscle would now gain dominance over the brow depressors and you would get a lift, which kind of explains how does a medication that paralyzes muscles lift somebody's brow? That's the answer, by weakening the depressors. But then if you say, well, I don't like these horizontal lines, then you add Botox for the forehead, but you're going to lose some of that lift as a result. But we put up with that because we want to get rid of both. We want to get rid of the 11 lines, we want to soften these. But when we do filler up here, what you find is you don't need as much Botox to take care of the horizontal lines, because the filler does that. So it really is a great marriage of filler and neuromodulator. Okay, so now I'm just going to be going with the lower dose up here. You doing okay?
Uh-huh.
Every now and then when we do these demonstrations, our model starts saying, I don't want to know all these details, and they get vasovagal, but Heather's a nurse, so she can handle it. She's been great. Okay, so I just did this, and now, what about, I mentioned before, just by putting filler here, these lateral canthal lines, crow's feet, we're going to, by weakening these muscles with Botox, we treat those as well. So we go above it, we go below it, and do the same on this side. And what we do, when we do Botox, we pay, everybody's different in terms of their muscles and how it works, so we pay really good attention to how many units we put in a specific area, and in a sense you map that person, you map their face, and you know going forward, if she comes back and says, you know what, I had too much movement here, I know next time exactly how many units I put there, and next time I need to do a little bit more, or whatever. You know, you can titrate. The other thing that a lot of people don't realize is you can titrate Botox. We have some patients that want to be the ice princess. They want nothing to move. Other people, you know, need to be able to scare their kids or expression. So you can titrate or modulate how much Botox to leave how much expression. Okay. So I still have another syringe on this side to use. So it's interesting, when Heather and I first met, a lot of these lines in here bothered her, but already by putting this volume up here, by putting this volume here, these lines are not as noticeable. But I am going to address them. I'm going to come in and I'm going to do a tiny bit of filler in here just to give subcutaneous volume to kind of soften these lines.
Now with the Botox, how much do you dilute it, or how is that done?
Well, Botox is done by units. So each vial, the vials come in 50 units and 100 units. And the very few doctors dilute Botox the way the package insert says, with 2.5 milliliters of saline. What most doctors now make it more concentrated, because studies have shown that if you inject more concentrated Botox, it's less likely to travel and to cause a drop. So we make it more concentrated. We put 1 cc in 100 units. So on an insulin syringe, every one of those lines equals 1 unit of Botox. But if you dilute it 2.5, then you're going to be putting more volume in. So if I had done that, everywhere that I had injected Botox, you would have a little bee sting, because there'd be more fluid in there. So it doesn't matter how you dilute it, it's how many units you use is really the short answer. It's really driven by units. Whether you put units in with more saline or less, it doesn't matter. The units are the active number. Okay, good.